20 seconds.
Since we're not connected with radio, we don't have to worry about it too much.
10, 9, 8, 7, 6, 5. We're on.
Hey, and welcome to Agri Talk. This is a show where we talk about subjects that are of interest to our growers and farmers and guys like that in the area.
I think so. Rural people, whether you're working in the daytime or nighttime or anything like that, it's typically businesses related to that issue.
Mm-hmm. So today we have a nurse practitioner on.
We do, and I think we've got a lot of good questions, and we'll have good answers, I'm sure, and a local person, so I'd say we get right to it.
Sure.
Today we have Sherry Russell. She is in the Jackson area, started up is it a family practitioner or is it just a?
It's a family practice urgent care office. I am a family practice certified nurse practitioner.
Okay, and so could you just tell us a little bit about yourself, how you got started or things like that, and then we'll get into some questions.
Okay,
So.
I was an RN for 17 years, graduate of Rio Grande Associate, and I was in their first bachelor's program. And like I said, I was an RN for 17 years. I had a very broad-based background with that. I was an ER nurse for 10 years. I worked at Holzer. I lived in Lexington for 3 years and did level 1 trauma at the University of Kentucky. I came back home to be closer to family with my boys, and did I did some more ER, and then I did a lot of CCU, ICU, OR. So I had a pretty expansive background. I always wanted to go on and complete my education and do my master's degree. The part about family nurse practitioner, which really interested me, is I like dealing with people. You have to enjoy working with people in this field, or you will.
I'm sure you do.
Not like your job very well.
Yeah.
So that was kind of what headed me in that direction, and I was able to work full time and go to Marshall for my master's and my nurse practitioner, which was very nice, having it close to home. So I was able to do that, and I've been a nurse practitioner now for about almost 7 years now.
Great.
What's the difference, and how is that, I don't know, your enjoyment and the experience of being a nurse practitioner or a OR or the ER nurse and all that?
Well, on the when you get into the practitioner level, we assess patients, we can order tests, we can prescribe medications, we can interpret those tests and decide what is the best course of treatment. We can refer if necessary, if they need to be seen by somebody else. So it's, you use all that clinical judgment and that education to be able to make those decisions. We, in the state of Ohio right now, nurse practitioners have a collaborating physician. We have to have someone on record with the state board that is our collaborator, and their role serves as they need to monitor a certain percentage of our charts. They would review it just to make sure that everything is kind of being done appropriately. They need to be available if we need to contact them, if we have any questions or problems or anything. They're a great resource for us. There is a House bill that is in the legislature right now, and it is House Bill 216, and it is anticipated, I think that's going into a lame duck session right now, and it's anticipated that should go into law if everything goes accordingly the end of March, and that is going to lift that collaborating physician need to a certain extent. I'm not exactly sure what the wording is. It's been through several different rewrites at this point. So that's going to be very good for nurse practitioners. It's a full practice authority. We currently do have Schedule II authority with medications. We have a lot of leeway in using our decision making on that. Although I personally do not, from my office, I will not write for any Schedule II narcotics. And there are limitations on how we can do that as well through the thing, but we have pretty good practice authority in the state of Ohio.
So when would you decide on whether I should go to a doctor or a nurse practitioner? Where's that line?
Well, a lot of times what will happen is if you say you come in and you see a nurse practitioner for family practice or in whatever setting, she can go ahead or he can go ahead and order the testing and things to find out what is going on with you and make a diagnosis and hopefully get you headed towards the right treatment. If it's something that needs referred on to a specialist or to another physician, by all means. I don't know any nurse practitioner that doesn't refer on when needed.
Yeah, like if your son had a wreck on his motorbike, he's got a broken arm and everything, probably.
Yeah, you need to go to ER. Yeah, you need to go to ER. Yeah, you need to be able to have the capability to do X-rays right at that time.
Okay, so you don't do X-rays?
I do not in my office. But what I do is if someone needs an X-ray and they're a regular patient of mine, and I do actually have this happen very frequently, they will come in, I'll write them a prescription, an order for an X-ray, and then they can go to any of the local facilities and do an outpatient X-ray. They do not need to be seen again, and then they will send me the results of that X-ray.
So you won't incur that extra office charge.
Exactly.
That's good.
And my office is in Jackson. It is rather unique to this area that it does not take any insurance at all. When I got this started, we've been open. It'll be 2 years in March. I own the business. It's Russell Family Healthcare, and it is an evening and Saturday clinic. It's family practice and urgent care. We are open Monday through Thursday, 5:30 to 9, and Saturdays 9 to 1. And what we do is we do not take appointments. It's walk-in only, and we take no insurance. And I actually had several people from out of this area tell me that I was insane for opening a private pay office in this area. Everybody said, it'll never make it. It's never going to work. But actually,
it's going really well.
We have exceeded our 5-year business plan already.
Great.
Really?
Yeah.
That's awesome.
I think it's a great idea.
Well, I do too. I just
And I
listening
had
to this.
the extra question. Okay, say I've got insurance and I come see a nurse practitioner. You charge me whatever it is. Now, does that go against, since you don't give it to the insurance, is that like just outside of my deductible, or can I count that against the deductible?
And actually, several of my patients have insurance, and like I said, and this is just specific to my situation in my clinic because I've worked at other facilities that take insurance and it's no problem. Nurse practitioners get reimbursed, and it gets turned in. It's not an issue. The way I am set up with my clinic, if someone comes in and sees me, we do $40 flat office visits, and we give you a receipt when you leave for that, and you can turn it in towards your deductible. Because what you find is most people come in and they have a copay of $25, $30, sometimes even a little bit higher copay, and then if they have not met their deductible, which the majority of people, unless you've had some catastrophic thing happen, you may never reach it, and what happens is they can turn that in on their insurance. Now, what happens in situations when you do take insurance with places, and I've had this in the past where I've worked, things are billed at a state-approved rate to the insurance company based on ICD-10 codes and based on that diagnosis, and it is turned into the insurance company. And then what happens is the each code has an amount that the insurance company has agreed upon that they're going to take for that code. And I can tell you it is far more than the $40 office visit. So if I did take insurance, technically I probably might make more money, but then what happens is it gets billed to the insurance company. The insurance company looks at that and says, Mr. Smith has not met his deductible, and so they kick that bill back to the patient. And then the individual has this bill that is far more than what the initial office visit would have been had they just been a self-pay visit of a $40 flat fee. And then the patient comes in, and number one, they think you've increased the bill when you turned it to insurance, which is not true at all. You don't do that, but it goes based on that code.
Based on the code, that's what, like you said, the state has agreed upon.
Yes.
Now, is every state different? Or is
I don't think so. And I'm just speculating on that. I think it's probably a across the board thing. Yeah, it would have to be because it would be incredibly confusing, I'm sure.
Yeah, I would think if not. I was just wondering if I assumed it was nationwide.
So I think 80 or 90% of the stuff that people get every day, the flus, the colds, and all this other crud that we pick up is what you see most of the time.
I see. We do see a lot of the basic walk-in urgent care stuff. I also do family practice, and I have a very large family practice base of patients. We do hypertension, diabetes, thyroid, high cholesterol. We try to do, just all the basic stuff that
Would you get women's yearlies and stuff like that?
Technically, we can. If someone's in a childbearing age range, I prefer them to see a gynecologist. But we are qualified to do that.
So you could do give them the pills or whatever prescriptions they would need.
You could do that, but if there's issues, you definitely want them to follow up with a specialist if there's issues.
Okay.
We order tests always, and what I try to do. We get a lot of working people, and when I had looked at opening this office, that's what I was looking at. I'd worked in the Jackson area. I'm from Gallia County. I've lived here the majority of my life. I looked at what was the need, and there was a very large need for things for working class people.
Right.
People can't afford to
Absolutely.
take off work and go
Right.
sit and wait 3 hours in a lobby somewhere waiting to be seen. People just can't afford to do that. And nobody has the time or the time off or can do it. And so I thought, there was a big need for evening hours and Saturdays. And like I said, and it has worked well. And I hear it all the time. People are very appreciative of that. I am also certified to do DOT physicals for truck drivers, like for the CDLs and things.
Okay.
And they changed the laws on that a couple years ago also, and you have to be specially certified to do that now as well.
But you can't do like a private pilot license.
No, that's a little more in depth.
Okay.
Yeah.
I've got one of those and haven't had one for a while. I'm not sure if they give it back to me or not.
Yeah, you never know. But it's there's and it's a good fit for a lot of the people that do have CDLs as well, because they're on the road. I had one guy call me one time, and he worked on the pipeline, and his wife called me on a Saturday afternoon, and he wasn't able to get in, and she said he's just going to be in for tomorrow, and they expire Monday. She said, "Are you open on Sundays?" And I said, "I'll tell you what." I said, "We'll be in here doing paperwork anyway." I said, "Bring him on in. We'll get his exam done." And it just you just got to kind of work with people
Flexible,
sometimes,
yeah.
and
Absolutely.
it does.
Yeah, where I kind of put the
Can't beat that.
nurse practitioner is sort of like the old family doctor that you used to see back in the 50s or whatever, that took care of your general stuff. And maybe not, I don't know, do nurse practitioners make house calls at all? I guess
if
you
you
could,
were set up appropriately, you could do that. And actually, if you were set up to, to do that, you could. And actually, I did bring some
I know you
statistics
don't,
with
but
me. Yeah, but
just
we may get something
one
started
of those
here.
old
Yeah.
things that, but
does.
it's, the general things that you don't need a lot of testing for. It's like, well, you got this, here's the treatment.
Things like that. And actually, and these are some statistics that I had just printed off. They're from the American Association of Nurse Practitioners, which is one of our certification bodies. And currently, it's about 55% of nurse practitioners right now are practicing in a family practice setting. 22% are doing adult and geriatrics. 6% are in women's health, and 6% are in pediatrics, and that's the most recent statistics that they do have. And also something I found that was very interesting, and everybody, is wanting to know, why is there such a need now for nurse practitioners that there wasn't. Maybe
Do
people weren't
not
so aware of.
go to school to be a doctor? Or?
Well, no, that's not. That's a fine line with that one too. It's totally different.
Yeah.
It's and that's what, and it's confusing a lot to the public, because doctors have a different. It's a different school. But we are, we're writing, nurse practitioners are writing prescriptions, we're assessing patients, and it is confusing to the general public. And I have people refer to me as doctor all the time, and I always correct them. I don't want anyone to ever think I'm trying to pass myself off as something that I'm not. But I'll tell them, I'll say, I am a nurse practitioner, and people ask what the difference is. Actually, I've had about 7 years of college. You look at your 4-year undergrad degree, and then you look at, by the time you can do it. You can do your master's and your nurse practitioner rolled up in 2 years of a really, it's a tight schedule. I had to work full time when I was doing it, so I did it in 3 years, as I have found that most of the nurse practitioners do. And we have a very, statistically, nurse practitioners are very well received by patients. And I think and nothing against physicians at all, but typically, we've been nurses for a while, and we are used to talking to patients and maybe doing a little more of the one-on-one education and taking a little more time to do so. And again, nothing against physicians, because there's a lot of docs that are great at educating
Sure.
patients as well. But I think sometimes patients just feel more comfortable with,
With a nurse practitioner, I guess.
Yeah, I hear all the time.
Not as
Yeah.
intimidated, I guess.
That might be the better
Maybe-
word, because it seems like a doctor is like, okay, what's your problem? Now I got to leave.
Yeah.
It's not that.
Or I don't know.
I don't know. It's a hard thing
You
to
can't have a
describe.
conversation as much, possibly.
Yeah.
And I'm sure that's, and that strictly depends on the person as well.
Sure.
And,
A lot of doctors I go to,
Yeah.
we can have long
Yeah,
conversations.
yeah, absolutely.
Yeah.
But I think that is just the general perception. And statistically, that's why nurse practitioners are very, very well received. And statistically, there's no difference in patient outcomes. And the recent statistics show that only 14.5% of physicians are currently entering a family practice residency, which means those are the docs coming out of med school right now. And so that means the field is wide open for family practice. Like I
Now,
said,
do you think more doctors are coming out of school and they're all concentrating on one particular specialty?
I don't think it's one particular specialty. I
wasn't sure if they were more specialized and you guys are more general.
I think, by the time they come through med school, they're it's a general thing for them too when they get out of med school, and then they can choose their residency.
Okay.
With nurse practitioners, we have extensive clinical hours built into our program as well. It's extensive, and it actually there's by the state laws, you have to have so many clinical hours with each program, and so it's very extensive by the time you get through.
Right. Yeah, my daughter works at Riverside, and she's been getting hers, and it's like working two jobs.
Yeah, it truly is. It's very time consuming, but it's well worth it. Right now, currently in the United States, there are 222,000 nurse practitioners, and it's projected by 2025 that there's going to be 244,000. So it's increasing. There's a lot of different schools. The problem that a lot of nurse practitioners are finding in these schools are finding clinical sites
She
to do their
struggled
time.
hard with that
Absolutely.
one. All
It's-
over she'd been to Cleveland and down here, just all over the state trying to
Yeah.
get to somebody.
There's a big need.
Why do you think it's such a big trouble? Or problem?
Well, you look at, we've got all these, people coming through school, these nurse practitioners, and they have got to find somebody to do those clinical hours with, and currently this is the statistics for for across the country right now. You're looking at just under 250,000 nurse practitioners across the country. And a lot of people don't like to necessarily take the time to have a
bothered
student.
with somebody looking
Yeah.
over
It
my
is.
shoulder all
Yeah,
the time.
I have always tried to, I've got nurse practitioner students scheduled in my office for the next year and a half. I've always got a student with me almost all the time.
Oh, really?
Yeah, it always kind of looked like, it's kind of I wouldn't say a duty, but it's, I always like teaching,
Kinda
and
paying
it's
back.
kind of paying it forward.
It's that give back. Yeah.
Someone took the time to do that for me, and so therefore, and I'll have students whenever we're talking, and
So do they
do that.
contact you, or do you go and
actually they contact you. But there's on the State Board of Nursing, you can get on there, and on the American Association of Nurse Practitioners, you can get on specific to your area, and they do have a list of students that need preceptors.
Yeah.
If people so choose to do that. Where it's a small community, we know a lot of people. It's usually the people I'm precepting or they're doing their clinical hours with me, or people that I've worked with at some point in the past.
Now, can you do stitches and other
Absolutely,
injuries?
I do stitches all the time. Minor procedures like that. I love to do that kind of stuff. Like I said, I was an old ER nurse, and it was just we did a little bit of everything.
Right.
I have
You probably
capability
couldn't
to do
take
all
a kidney stone and
nah.
because you need
Yeah.
heavy narcotics for that
Absolutely,
sucker.
absolutely. We do stitches all the time. We do a lot of, like I said, a lot of just that kind of stuff. Simple. If somebody comes in with a mole skin tag, something that's obviously nothing that's sinister looking.
Right.
We do a lot of that stuff too. If it's something that I feel deserves, has any potential to look bad at all, I always send them to dermatology for that type of stuff.
So there's a couple other things. I don't know is it a PA,
Physician assistant.
and a hospitalist.
Yeah.
What's the difference?
Yeah.
A hospitalist is simply someone that's covering the hospital on call for whatever's going on in the hospital.
Is that a doctor or is that
Well,
nurse?
actually, it can be both now.
Yeah,
A lot of facilities are using nurse practitioner hospitalists, and basically, if they've got somebody there, you look at a lot of night and weekend type stuff with that, and even sometimes during the day. but that way they've got someone to call for those patients, to handle the things that are coming up with them right at that time. And it's just basically the on-call person for the hospital at that time. And a PA is a physician's assistant. And that is kind of confusing as well, too. The lines kind of blur a little bit with that.
Right.
They are, and I actually have several friends that are PAs. They usually have a bachelor's degree, usually it's in a science field or something such as that, and they go specifically to a physician assistant school. They are meant, they were kind of designed along to maybe work closer like with the physician. They have full prescriptive, they have their own prescriptive authority and things as well. Their bylaws are just a little bit different than ours. And what I have found historically is that the PA associations maybe aren't as proactive for independent practice as the nurse practitioners are. And then nothing against them as well, but that just is statistically what's...
I wasn't sure where they fit into the system.
Yeah, it is, but in a lot of jobs, so you'll see they are interchangeable. They can either be for a PA or an NP, depending on, on what the need is. So it just, and we can do a lot of the similar things.
So do you, with that, you don't go to any hospitals?
No, I am not affiliated with anyone with my
really.
office. No,
it's only yours.
It's
now,
mine.
So if one of your patients needs to go to the hospital, can you admit them, or do you have to get another doctor?
I cannot admit them, and typically, and I've had this happen a couple times. I've had patients come in with chest pain or shortness of breath, and there's been a couple times we've had to call the squad for patients just because they're not. I don't feel safe them leaving and driving themselves to the hospital or something like that. And in that situation, they go directly to the ER, and then they're worked up there, and then it's handled from there.
So like that, it's just that would be just like they would just go straight to the ER. It's bypassing you.
Yes.
So you don't get any of those records, or do they ask you?
Well, when it comes to
bring them back.
When it comes to records, the system I use is called Practice Fusion. I'm not linked to anyone. I'm not associated. I hear that all the time. What hospital are you with? I'm not with any hospital. I'm a sole proprietor LLC. But what happens is if we absolutely want to interchange records with people for continuity of care for patients. And so what we look at is that we have them sign a release of information if we need records from a facility or another office, and then we just fax, and they'll fax us over the records. Or vice versa, if say someone's got a primary physician at a local hospital and they come and see me for something, and they will sign a release of information, and we will fax those records over so their doc knows what we did as well. And,
who becomes a nurse practitioner? Is it that frustrated nurse that's like, I could have done that,
Yeah.
Well, actually, it's you see a wide variety. I think in the past, I think we've had a lot of people that were like myself that were nurses for years and years, and raising families and just going to school and working and just worked our way up, which is exactly what I did. I think in the most recent past, I think you're seeing a lot of people go into RN school with the idea of, I'm going to be a nurse practitioner.
So was that your goal when you
No.
first started? You just
No.
said, I'm going to be a nurse, and that's
No.
it? What made you go on into the nurse
field?
Yeah.
Go on into the nurse practitioner field?
Yes.
I liked what I did, and I've always been one of these people that I like to stay really busy, and I've always have different interests, and like I said,
from the way you explained your hours.
I work full time with Woodland Centers, which is a local community mental health agency here. Local, I work for the Gallia County, the Gapless office, and I work there Monday through Thursday, 7 to 5. And I also, I see outpatient mental health patients for Gallia County. I am family practice certified, but I have a very strong psychiatric background.
So what do you deal with there?
There, we actually have an inpatient unit, and I do cover mental health medications for that unit and assess those patients as well in the facility. And then I see outpatients, and the same thing. I talk to them and write for their mental health medications. And then we always work in collaboration. We have Woodland Centers, actually, I've lived here my whole life, and I have only been at Woodland Center since March. We have so many services that I did not even know existed. Counseling, groups, the community resources are just amazing, and it's kind of nice to know that that's all there. Like I said, I think the general population probably maybe isn't quite aware of everything they do offer.
I don't think so.
No, but
Maybe
it's so.
somebody we need to have on some point.
Yeah, absolutely. we'll work on that. I'll fix you up.
Yeah.
There you go. We have a contact.
But,
there.
Okay.
But it's, so I do that 7 to 5, Monday through Thursday, and then my office is Monday through Thursday, 5:30 to 9. So I leave Woodland Centers and head straight to Jackson. And then I'm in my office 9 to 1 on Saturdays as well. Like I said, and one thing I went last year and got certified to do Botox, and recently went here a couple months ago for certification for dermal fillers. And you would be amazed at the response I have had locally with that. It's done very well.
What's the difference? Botox, dermal
Botox,
fillers?
it's fun. Number one, it's fun to do because it's anything we can do to make ourselves feel better. I'm all for.
Okay.
Botox acts by actually paralyzing the muscle, and it's great
That's
for
that bee
these
sting
areas.
stuff, right?
Yeah.
It stings a little bit, but it's
I mean, that's what it was made of, right?
bee stings. It's made of like a botulinum toxin type
Right.
thing. Yeah, but it's great for the lines between the eyes, the forehead, crow's feet, and then the dermal, what it does is it paralyzes the muscle, so therefore everything looks much more smooth. The dermal fillers, actually you inject, it's more like for these creases right here, lips, and the deeper creases like that. And that lasts up to a year. Botox lasts about 4 months or so, but the dermal fillers up to a year. But but the really nice thing about it is it just kind of demonstrates everything that that we can do, and from a business aspect, like I said, I like to stay busy. I like to do a lot of different things, but
But you do that at a different location.
actually,
Would you
I do that in my office.
You do? Okay.
And then Elite Look in Gapless, which is a very nice salon there. I have a room set up down there too that I do that of.
Just a
in my spare
wide range
time.
of things she does. So.
But it's kind of. But I think it just kind of demonstrates the different things you can pursue once you, when you do this.
You could probably do piercings too if you wanted.
Let's not do that.
That's a whole other topic.
But
she's here to cure the problem in some cases, or whatever it might be.
yeah, but it's just, but it really is. I feel very blessed and very fortunate that I have such a good group of patients, and that I've had the ability to do so many different things. Like I said, I get bored super easy, and so it's really nice to be able to do
Doesn't sound like
certain
you're
things.
bored.
I don't think
My
there's
kids are all
time to be
grown.
bored.
Yeah,
So.
my kids are all grown. They're 31 and 24, so it's
Yeah.
great.
So we're getting close on time anyway. So what is there a message that you would like to get out, a little advertisement piece or anything like that you can tell our audience or anything like that, and we'll come back with the last question or something.
Okay. No, I think the general community are pretty familiar with nurse practitioners. We do a wonderful job. And like I said, I think it's very well accepted in this area, and it is pretty much, I think, nationwide. But there's just no end to what you can do if you want to work hard and get that education.
Mm-hmm.
That's awesome. So you're in the Jackson area,
I am.
and now does that say if somebody's from another county, can they still come and see you?
Absolutely.
Doesn't matter. Now, do you look to expand at all?
Actually, yes, I would like to possibly open an office in the Rio Grande area here in the next 2 or 3 years.
Awesome.
Yeah.
Well, I think we're out of time for now.
Yep.
So.
Well, thanks for watching Agri Talk, and stay tuned next month for another cool episode.